From Healthwise Lung Screenings and Katelyn Robertson, a respiratory student at Jackson College. How are you guys doing?
Good.
Wonderful. How are you?
Doing good. So we've got a screening event coming up.
Mm-hmm.
Tell us all about
Tell
it.
us when.
Yeah, so it's going to be on Monday, April
Okay.
15th from 11 to 3, and
Okay.
it's at the college campus. And our respiratory therapy students, like Katelyn, are going to be participating and running it.
Oh, that's cool. So tell us why, I'll ask you first, Sarah. Sarah, why is this important that we get our lungs screened?
Absolutely. So, your lungs are very important, obviously, and a lot of times people think, heart screening is very popular.
Mm-hmm.
There's a lot of screenings that are more well-known, colonoscopies, things like that. But the lungs are just important, and there are basic screenings that can be done that can tell or warn about very serious conditions. So asthma, COPD, emphysema, sleep apnea, things like that.
Is this something that you guys do on a regular basis? Like you can make an appointment for it, or is it just when you do events?
These are just events.
Okay.
So, because of the innovation center that is coming up and growing, we are doing these events more often, and we want to showcase our students and what they're able to do and provide education. So they're going to be occurring much more often.
Nice. And Katelyn, you're a student in the program.
I am. I'm a second-year student.
How's it going?
Wonderful. We're graduating in December, so we're on the home stretch here.
Nice. Congratulations.
Yes.
What can our viewers expect if they schedule a screening? What is it like for them?
So we're offering a couple different tests. There's a sleep apnea test. There's a 6-minute stress walk test. There's PFTs where you're gonna we kind of see how your lungs handle different situations. There is
EKGs.
EKGs,
Yep.
yeah, sorry. EKGs where, we're going to be looking at your hearts and,
Okay.
we send that stuff off to get looked at by professionals,
Should you do the sleep apnea?
No, I don't have a.
No?
No, I sleep like a baby. But I do know a lot of people it seems like it's more common. Is that the case?
It is.
It is.
Yeah.
Absolutely.
It really is, yes.
And it's very important to be screened for sleep
Right.
apnea. You don't have to snore in order to have sleep apnea. And sleep apnea can have a lot of complications, including heart disease and other conditions as well. So basic screening is
Yeah.
easy, simple, and should be done.
Caitlin, what are some of the things that you've learned about respiratory health over the course of your education?
Oh, that's a broad,
A very broad question.
Everything.
Yeah.
We are specialized in the respiratory system and, your pulmonary system. So we have gone over it all from, the very basics of, what, your inspiratory pressures, expiratory pressures are to, running ventilators. And now we're into hemodynamics, which is how your heart functions with your lungs and how different pressures affect different things. And when we, add in different therapies and how it can affect the whole system. So it's pretty deep.
Yeah.
Obviously we're, in charge of the airway in the hospital. So you have to have a broad understanding of how everything works. So
You mentioned that you have a 5 and a 6-year-old. What is some advice that you could give to young people to keep healthy in your respiratory system?
Oh, definitely. Definitely no vaping, no smoking.
No vaping, no
Oh my
smoking.
goodness, that is my biggest pet peeve. I've got a ton of friends that vape, and I'm like, no.
Yes.
It is not better for you by any means. It actually chemically burns your lungs and
Yes.
is way worse than smoking is. And unfortunately, it's so new that we just have no idea how that's going to look, in 10 years.
Right.
Honestly, just job security for us at this point,
Yeah.
sadly.
Yeah,
But
that's a great point. Sarah, talk about early detection and some of the things that maybe can be found in this health screening. Early detection is so important.
Oh, it's key. It's absolutely key. So the pulmonary function test she was talking about, first and foremost, gives a good indication of overall lung health. So people may not feel symptoms of COPD or asthma, and those are very important to stay on top of, because once you have an exacerbation, then there's more complications that can occur and lung damage. So early detection and screening is absolute key. And just even like a basic chest x-ray, which is not included in this event, but looking for lung nodules for those who are chronic smokers is just a very important screening tool. You want to catch all of that as early as possible.
Caitlin, what are some things we can do to breathe easier?
to breathe easier?
Yeah.
Well, definitely exercise. Make sure you are exercising your lungs. That's important. Definitely, stay on top of your lung health, just like she was talking about. Like, there's, everyone does, cardiac screenings and that stuff. So, pulmonary screenings are just as important because, like she said, there's some things that you don't know you have until you get screened.
Yeah.
And that can give us a better route of palliative care to keep you healthy as long as we can. So.
Awesome.
Nice.
Well, thank you guys so much for coming in. And one more time, we will tell everyone when that is. It is next Monday, and you can make an appointment, or you can just show up, right?
Yeah, we'll just take anybody from
Awesome.
11 to 3.
11 to 3 at Jackson College Central Campus. Thanks to Sarah Case and Katelyn Robertson for being with us this morning.
Thank
Appreciate
you.
it.
Thanks for having us.
More of the show right after this quick break.